Talking about the different endocrinal abnormalities, when we're discussing the thyroid gland particularly, we can have the states of hyperthyroidism, which we have already discussed. That is basically also known as thyrotoxicosis or the Graves' disease in the individuals. Obviously, it has its own neuropsychiatric manifestations, mainly presenting as phases of mania or depression. They can also suffer from delirium, delusions, or hallucinations. So these are the different neuropsychiatric manifestations manifested in a person who is suffering from hyperthyroidism. Over here, we are discussing a state in which we have the thyroidal secretions in least amounts. They are present in the blood. The T3 and the T4 levels are decreased in the blood serum levels, and even the TSH levels are also monitored in such a case. So we'll be discussing them over here. We'll be discussing this condition of hypothyroidism over here in this section. What are the causative factors? What are the causative agents? Then the risk factors making the person more prone to the development of this hypothyroidism. And then again, the neuropsychiatric manifestations of this hypothyroidism. Then there is another condition which is known as a subclinical hyper or hypothyroidism. We'll be comparing even these two conditions, these two clinical conditions, in which the lab investigations, they prove to be normal in the person, but still there is something wrong with the thyroid gland. That is basically the functioning of the thyroid gland is altered in such people, and they are presenting with these psychiatric manifestations in the outpatient department. So we'll be discussing them over here in this second section. First of all, the definition of this condition, which is known as hypothyroidism. What are the neuropsychiatric complications that are associated with hypothyroidism? We'll be discussing them over here, and then we'll be moving on to the affective disorders. That is basically the mood disorders that are associated with the hypothyroidism. Usually, it's the depression that is associated with the hypothyroidism. There are mood swings that are particularly observed in people who are suffering from hypothyroidism. So we'll be discussing them over here. The neuropsychiatric symptoms are quite a common manifestation of hypothyroidism. They are considered to be affective disorders. That is basically the mood disorders ranging from mania and depression as well. Basically, it's a bipolar condition that is seen in these people. Psychosis is also observed in a lot of cases. So the onset of symptoms is often gradual in these patients. There's a slow progression that is very common in these patients, especially in the elderly patients, and mimicking a development of degenerative dementia in these individuals. So this is the mainstay over here. That's basically a confusional state that is developing in the elderly individual, and usually it can be confused with a normal physiological phenomenon of aging, in which even the aged or the elderly people can have a confused state even without the condition of hypothyroidism. So this is again very important over here to consider. Then we have the neuropsychiatric complications, slowed comprehension, and then the person will be also suffering from abstract thinking, impairment in attention, and recent memory. So there's going to be there's not going to be a retrograde amnesia. The kind of amnesia that is observed in these people is the anterograde amnesia, and the recent memory cannot be stored. So this is the complication quite commonly seen in contrast to the cortical dementias, the Alzheimer's disease, and the frontotemporal degeneration. The cognitive disorder of myxedema doesn't present with discrete cortical syndromes. So this is again very important when you look at this picture of myxedema madness. You would see that the patient is quite different from the presentations of the Alzheimer's and the frontotemporal degenerations, and you can easily distinguish the dementias between the three. Aphasia, anomia, apraxia, and frontal disinhibition. So these are the characteristics that are the highlights in the myxedema madness. There's going to be an aphasia, anomia, apraxia, and then frontal disinhibition is also observed in these patients. When we have a condition which is known as subclinical thyroidism, we can have a look at the TSH levels. The TSH levels are above the normal range in these individuals, that is above 4, and the T4 levels are in their normal range. So when we just have a look at the T4 levels, they're going to be in the normal range, and so the person can basically argue with you that what are the causes of the hypo or the hypothyroidism, even though I have the normal T3 and T4 levels. So basically the question arises over here is that we will have to observe the TSH levels in such a condition. If the TSH levels are above the normal range, then such a person is going to be considered as suffering from the subclinical condition or the subclinical hypothyroidism in such a case. The affective disorders of hypothyroidism. Basically, hypothyroidism, the people who are suffering from hypothyroidism have a greater risk of being admitted for the treatment of depression or bipolar disorders. The risk was greater in the very first year. And depression, psychomotor retardation, then they can also suffer from sleep and appetite disturbances and hedonia, that is basically loss of interest in the activities which were previously found interesting, reduced libido, reduced sexual functioning, emotional labilities. Suicidal thinking is quite a significant picture in these people. Delusions, they also suffer from these firm beliefs. Even they can suffer from some sort of hallucinations ranging from tactile, visual, and auditory hallucinations. In these cases, hallucinations in more advanced illnesses are quite common in such a case. Then when we talk about the subclinical hypothyroidism, DeMartini et al. In 2010 found that thyroid replacement alone is not effective in these people in producing the remission of the depressive symptoms. So it's just not the thyroid replacement therapy in which we basically start off with the oral T3 and T4, and that is basically just not the case over here, and the effective causes cannot be treated by this way. The meta-analysis of individuals with treatment-resistant depression. So when we have a patient at our hand who is basically resistant to treatments along with depression, that means that there is some sort of a subclinical hypothyroidism that he or she is suffering from. So the investigations are very important over here to carry out on regular basis. The interval between the investigations can be almost 6 months. They demonstrated almost 50% had subclinical hypothyroidism in these cases, and the responses to the antidepressant therapies are reduced if the thyroid disease is untreated. So in this case, if a person is suffering from hypothyroidism, and even if he is being treated for depression, he is going to be resistant for the antidepressant therapy. So over here, treating the underlying pathology in this case is very important, just to take the person out of that depressive episode that he or she is suffering from. The patients can present with symptoms of elevated mood and energy, irritability, psychomotor agitation is quite common in these patients, decreased need for sleep. Then they can also have an increased goal-directed behavior observed in these people. They can suffer from a pressured speech. Flight of ideas is observed. There can be the delusions of grandiosity. And they can also suffer from different kinds of paranoid delusions or different hallucinations of auditory, tactile, and visual kind. So in this section, basically, we summarize this condition which is known as hypothyroidism and what are the neuropsychiatric complications that are related to this condition which is known as hypothyroidism. So that is the end of this section. Thank you for watching sqadia.com.